confused about the difference between home care, home health, and hospice? Many families struggle to understand the difference between these three types of care, making it a challenge and to choose the right option. My name is Betsy Miller with Home Instead in Orange Park, Florida. Home care, which is what we do, we provide in-home services that encompass a broad range of non-medical services such as personal care, bathing, dressing, grooming, incontinence care, things of that nature. We also do home helper tasks such as light housekeeping, meal preparation, and transportation. Usually, a home care company will have a minimum number of hours, between 12 and 24 hours a week, but it's always good to ask. You never know if you might need to start with a few less hours, and maybe as you become comfortable with home care, you can grow into the minimum. We also have different types of payment options. Most of the time, it's going to be private pay. But there are situations where you could, if you're a veteran, get approved for veteran benefits. There are direct authorization benefits that you could get through your doctor, or you can go through what's called aid and attendance, which is almost like a long-term care policy that's paid to you monthly. Lastly, there sometimes are community benefits and grants available within the community, or of course, many customers or many clients in the past have invested in a long-term care policy. Long-term care policies are great options to help supplement or in some cases pay for the home care 100%. Home care companies, if you find an educated individual within that company, many times they can really help you with a long-term care policy, from understanding your benefits to helping you actually open the claim. The next is home health. Now, if you remember, the first one I talked about was home care, and this has a different meaning, which is home health. And many times people get these two confused. And many times, home health is something that is covered by Medicare. So when you're discharged from a hospital or a rehab, Medicare will cover the home health. And another word for this is called skilled care, which encompasses physical therapy, occupational therapy, and RN services. It's usually for a period of time. So Medicare will say, okay, if you were discharged from the hospital or you were discharged from the rehab, you can have services for 90 days or 120 days. And then you're also limited to how many times per week that service can come in as well. And it's also based on improvement. So if your loved one or the patient is improving, then those services will slowly dwindle. If the patient is not improving, they can possibly give you a little bit more time as well. So just remember, home health is Medicare, Medicaid, and home care is more of the non-skilled services such as bathing, dressing, grooming, meal prep, transportation, and medication reminders. Next up is hospice services. And hospice has both the regular hospice services and palliative care. This is a sensitive topic for many people, but it's really good to understand the differences, because what's covered through your Medicare policy would really depend on what would be the best service. So it's in your best interest that if you're in this position where hospice is mentioned or offered, to definitely explore that, because your loved one or yourself may get more benefits from hospice. So these hours are again going to be limited. So a lot of times people think hospice, oh, it's 24/7 care, but it's usually not, especially in the home. There is something called crisis care that once in a while they can come in for a 24 or 48-hour period, but it's not long term. So again, you have to think that hospice is going to provide some great services, but you might need to supplement it with the home care as well if you need it for your loved one. And hospice is covered by either Medicare or Medicaid. How does home care, home health, and hospice work together? So let's just say that you have home health in the home. That's the skilled care, the physical therapy, the occupational therapy, and the RN. You really want to make sure that when they're not there, that either a family member or a caregiver is there to remind them to do their exercises. That's one of the best examples, because if you get behind in the PT or the OT, then your loved one's not going to be getting better at the pace that they need to or they can. And I'm sure they want to be back to normal as quickly as possible. Medication reminders is another way that RN is going to come in once a week and make sure that the medication's correct and things are going in the right direction. But during the off time, that caregiver can help to make sure that those medications are taken as prescribed and on the schedule. So that's a way that continuity of care is so important, and it's really preventing and helping to ensure that your loved one is not going to have an episode where they're going to have to be readmitted to the hospital. One way that a home care company works hand in hand is if one of our caregivers notice that there is a change in condition, they can immediately call our office and we can reach out to that home health agency and give them a heads up. And they might say, oh, we'll send out a nurse today or tomorrow rather than next week. And if it's something as simple as a UTI, they can get antibiotics and solve that first and foremost before there is an emergency room visit. When it comes to hospice, that's a little bit different because the care is more about keeping the client comfortable. So one of the things that our company does is we train our caregivers in, really paying attention to the customer. Is that client comfortable? Are they in pain? And we might rate their pain, say on a scale of 1 to 10, and providing that, writing that down and logging that information. How much did they drink? How much water intake did they have? Did they eat anything? How much did they sleep? All of that is great information to provide to the hospice worker to make sure that they're keeping that patient comfortable and in as good of a situation as possible. So again, that continuity of care is really important for the whole overall well-being of your loved one. If you would like to learn more about working with us, you can go to our website, www.homeinstead.com/193.